Welcome to the Deep Dive, your shortcut to getting truly well-informed. We grab a mountain of fascinating info and boil it down to the most important, surprising bits just for you. Today, we're plunging into the absolute magic of new life in horses, the incredible journey of equine reproduction. Imagine the quiet wonder of a mare carrying her foal. It's a process that blends ancient instinct with, well, truly cutting-edge science. Our mission for this deep dive is to unpack one of the most critical aspects of that journey, understanding the intricate world of equine pregnancy diagnosis. We're drawing from some really solid expert sources today, and you're going to gain a clear understanding of how veterinarians actually confirm pregnancy in mares, how they navigate potential issues, and ultimately how they work to ensure the health of both the mare and the foal. And as you'll discover, the timing and the specific findings, they are absolutely critical. So when it comes to confirming a pregnancy in a mare, what's the very first hint people traditionally look for? Long before all the fancy equipment. It's pretty subtle, right? If a mare had been bred, the first clue she might be pregnant was simply that she failed to return to estrus, or what we commonly call heat, usually around 16 to 19 days after ovulation. But here's the kicker. Early on, actual physical changes in the mare are often minimal, like really minimal. She might not look any different at all.
Exactly. Those initial physical changes are so subtle you'd barely notice. What's truly remarkable, though, is how a mare's body transforms as the pregnancy progresses. You'll definitely start to see, recognizable abdominal distension, that growing baby bump, and a general weight gain. Then in those final 2 to 4 weeks before she's ready to foal, her mammary glands, or udders, will significantly develop, and you'll see fluid ranging from thin and clear to, well, thick and creamy, secreting from the nipples. It's her body just preparing for motherhood. But this isn't always a straightforward story for diagnosis, and this is where it gets really interesting, actually, because mares can throw some curveballs. They might fail to cycle for reasons other than pregnancy, creating what we might call false alarms. For example, some mares naturally go into seasonal anestrus, where their ovaries just sort of quiet down for a period. Or they might experience behavioral anestrus, meaning they are cycling, hormonally speaking, but simply don't show the outward signs of heat. It's confusing. There's also prolonged luteal lifespan. That's where a corpus luteum, that's a temporary structure on the ovary producing progesterone, which is crucial to sustain early pregnancy. It persists for too long, so it keeps her out of heat even without a pregnancy. Vets can sometimes give a hormone, prostaglandin F2, to help reset the mare's cycle by breaking down that persistent structure. And then, in more serious, though thankfully rare, cases, conditions like granulosa physica cell tumors or even chromosomal abnormalities can cause a mare to appear non-cycling. It's quite a diagnostic puzzle sometimes.
Wow, yeah. It sounds like trying to guess pregnancy based just on behavior is a bit like playing charades with a horse. Our sources highlight that if a mare is teased to a stallion, basically, put near him to see her reaction, she should show estrus signs 16, 18 days after ovulation if she's not pregnant. But as you said, even this isn't silver bullet. You can get false positives, right, where a mare fails to show estrus even though she's not pregnant. Maybe it's a silent heat where she just doesn't feel the urge to display signs, or maybe she lost the pregnancy after certain structures formed, or that prolonged ovarian activity you mentioned.
Exactly.
And then, surprisingly, there are false negatives, where a mare actually shows estrus signs even when she is pregnant. So clearly we need more definitive diagnostic methods than just watching her behavior. Which brings us to the incredible tools veterinarians use today. Let's start with a classic, transrectal palpation, or TRP. This is often the first method people think of, involving a vet manually feeling the uterus and ovaries through the rectum to detect those subtle changes.
Right. And the skill involved in TRP is truly fascinating. While a very experienced veterinarian might attempt it as early as 18-20 days post-ovulation, getting consistently accurate results usually happens more like 25-30 days onwards. It's a method that can be used throughout much of gestation, but it does change as the pregnancy advances.
So what exactly is the vet's hand feeling for in there?
That's the key question, isn't it?
Yeah. Our sources detail a remarkable progression. Around days 15-18, the veterinarian can feel the uterus itself firming up, sensing the distinct T-junction where the mare's uterine horns begin to split. It's like feeling for a change in texture and architecture inside. But at this stage, feeling a true bulge is incredibly difficult, especially in mares who had foals before. And there's a delicate balance, because harsh palpation risks harming the tiny embryonic vesicle. You have to be careful. The cervix, too, that gateway to the uterus, actually clamps shut. It feels firm and dry, essentially putting up a do not disturb sign for the next 11 months or so.
It's quite distinct when you feel it.
Then, by days 25-30, the uterine wall is very distinct and firm, and a small bulge will be the size of a small hen's egg, might be felt at the base of one of the uterine horns. By days 35-40, that bulge is more like tennis ball size.
Right.
Days 45-50, softball sized. And by days 60-65, it really begins to expand into the main body of the uterus, resembling maybe a child-sized football. And the uterus starts to pull downwards ventrally.
Yep, gravity starts to take effect.
Much later, around days 150-210, the uterus descends completely into the lower abdomen, and the fetus itself may be consistently felt by a technique called ballottement. That's where the vet gently pushes to feel the floating fetus, right?
Exactly. You give a little push and feel it bounce back. Near term, the foal is readily palpable. It's truly like reading a living timeline with your hand, if you're skilled. But, while TRP is a foundational method, it does have its limitations, despite that incredible skill needed. As you highlighted, it relies heavily on the examiner's experience, and it's definitely less accurate in those very early stages. It also cannot reliably detect twins, especially if they're nestled close together, which is a big issue. And although it's rare with an experienced palpator, there's always a slight risk of a rectal tear, which is serious. It's also worth noting that a functional corpus luteum in a non-pregnant cycling mare has the same effect on the cervix, that tightening, as pregnancy does. So just doing a vaginal speculum exam to look at the cervix isn't enough on its own to confirm pregnancy.
Right, that makes sense.
Yeah.
Which brings us to arguably the most transformative diagnostic tool in modern equine breeding: transrectal ultrasonography, or US ultrasound. This truly lets us see inside, and it's become the most common, accurate, and, well, preferred method for early pregnancy diagnosis.
It's truly incredible how much detail ultrasound provides, and timing is absolutely critical here. While it's possible technically to detect a pregnancy as early as 9-11 days post-ovulation with a really high-quality scanner, the optimal routine time for that initial scan is usually 14-16 days post-ovulation.
Okay, why that specific window? 14 to 16 days.
Well, this timing is absolutely crucial for early twin detection and management. That's a major concern for breeders, as we'll discuss. And then a follow-up scan at 25-30 days, or sometimes docs wait until 28-32 days, is highly recommended. This second scan is vital to confirm fetal viability by actually seeing a heartbeat, and also to recheck for twins, because sometimes a twin vesicle might have been missed or even disappeared spontaneously on that first scan.
And the visuals on ultrasound sound amazing. Our sources say at days 10-11, you see this tiny round anechoic, meaning black, right? Because it's fluid-filled embryonic vesicle.
Correct. Black on the screen.
And it's often still migrating around within the uterus at that
It
time.
moves, yeah.
By days 14-16, it's a distinct spherical vesicle, about 15-20 millimeters across, and it's typically fixed, meaning it's stopped migrating and is settled in one spot, usually in one of the uterine horns. You might even see a bit of uterine edema, like swelling, around it.
Sometimes, yeah.
Then, around days 17-21, that vesicle might start to look a bit more angled, almost. The sources say guitar pick shaped.
Yeah, that's a common description. It loses that perfect roundness for a bit.
By days 20-23, the embryo proper, the actual little fetus, becomes visible within the vesicle. And then, the definitive sign, the moment everyone's waiting for. Around day 24-25, a clear, rhythmic flicker on the screen. An unmistakable heartbeat should be detectable.
That's it. That's your proof.
That's your undeniable proof of a viable pregnancy. And as the pregnancy progresses, you can actually see the embryo changing position as its umbilical cord lengthens, as like watching a tiny movie unfold inside the mare.
It really is. And that tiny movie gets even more detailed. It's truly remarkable that ultrasound also allows for fetal sexing, which is, a big deal for breeders planning for the future.
Wow, sexing too. When can they do that?
Typically around 60-70 days of gestation, though it definitely requires high-resolution equipment and a very experienced eye. It's not easy. The method involves locating the position of the genital tubercle. That's the precursor structure that becomes the clitoris in females and the penis in males. It's a tiny, tiny structure, just a couple of millimeters across, almost imperceptible.
So how do they tell?
It's all about migration. In females, that tubercle moves caudally, so towards the mare's tail. In males, it moves cranially toward the mare's umbilicus or belly button. Skilled operators use landmarks inside, like the fetal mandible or heart, to orient themselves and accurately determine its position. And later sexing is also possible, say, from about 95-130 days, or even up to 240 days using either transrectal or transabdominal ultrasound. By then, you're looking for more developed external genital structures like the mammary gland and clitoris in females versus the penis, prepuce, and scrotum in males. It's easier later on, but the early window is often preferred.
So what does all this mean for ultrasound? I mean, the advantages seem huge. Our sources highlight it truly have the highest accuracy for early diagnosis, giving vets a clear picture right away. It's absolutely crucial for the early detection and management of those twin pregnancies, which, as you said, are really high risk.
Extremely high risk.
It allows for the definitive assessment of fetal viability through that heartbeat detection. And it lets veterinarians evaluate the overall uterine and ovarian health, plus monitor the pregnancy's progression. It really seems like an indispensable tool in modern breeding.
Absolutely. Game changer.
Okay, so beyond the hands-on and visual methods, we also have blood tests. These give us valuable chemical clues about pregnancy, right? Hormone assays. Think of them as different types of chemical detectives, each with their own specialty.
Exactly. It was a good way to put it. Let's look at 3 key ones. First, the progesterone assay, often called P4. This test is primarily useful around 18-20 days post-ovulation. High levels suggest the presence of a functional corpus luteum, which, as we mentioned, is necessary for early pregnancy. So it makes it a presumptive test.
Presumptive meaning likely but not guaranteed.
Precisely. Because it's crucial to understand its limitation, false positives can occur. A persistent corpus luteum may be because of an early embryonic death that happened after the body recognized pregnancy, or a pseudo-pregnancy where the mare acts pregnant but isn't, or even certain uterine infections like pyometra can produce high progesterone levels even without a viable pregnancy. So this test isn't useful for monitoring later pregnancy stages, but importantly, a low progesterone level is a strong indicator that the mare is not pregnant, so it's good for ruling pregnancy out.
Okay, that makes sense. What's next?
Next is the equine chorionic gonadotropin assay, usually called ECG or sometimes PMSG. This hormone is detectable in the mare's blood from approximately 35-40 days to about 100-120 days of gestation, with peak levels around 55-70 days. Elevated ECG tells us that unique structures called endometrial cups have formed in the uterus. These cups are actually created by cells from the developing fetus itself, invading the uterine lining around day 36 or 37.
Wow, fetal cells make them.
Yes, and they play a vital role in producing more hormones to maintain the pregnancy. But here's the really significant limitation and the big source of false positives for this test. If embryonic death occurs after those endometrial cups form, so after around day 35, the ECG levels can remain high for weeks or even months, sometimes up to 120 days, even though the mare is no longer pregnant.
So the test stays positive even if the foal is gone.
Exactly. And this means she won't cycle back into heat either because her body still thinks it's pregnant due to the ECG. It's a major issue. And critically, an ECG test does not indicate fetal viability. It just tells you the cups formed at some point. Also, you can get false negatives if you sample too early or too late in that window, and it's not reliable for donkeys or hinnies, only horses.
Okay, that's a really important caveat.
Yeah.
What's the third hormone test?
Finally, we have the estrone sulfate assay, or E1S. This hormone is detectable from approximately 60 days of gestation all the way to term, and its levels rise significantly after 90-100 days. What's really important here is that estrone sulfate is produced by the fetal placental unit, meaning it's a product of the developing foal and its support system, the placenta.
Ah, so it's directly linked to the baby.
Directly linked to a living baby. So a positive test indicates the presence of a viable fetus. If the fetus unfortunately dies, estrone sulfate levels will rapidly decline. This gives it a clear advantage over ECG. It truly confirms fetal viability later in gestation.
That sounds much more useful for checking on the foal later on.
It is. The main limitation, of course, is that it's not useful for early pregnancy diagnosis, as the levels only become significant later on, after about day 60 or really day 90.
Got it. And for those later stages of pregnancy, when the mare is getting quite large, there's another ultrasound method. You mentioned one that doesn't involve going rectally. Transcutaneous ultrasonography.
Exactly. This involves scanning right across the mare's abdomen, just like they do with humans. This method is typically used from about 5-6 months of gestation right up to term. It allows veterinarians to visualize the fetus itself, see its movements, assess the heartbeat, check the fluid levels around the foal, evaluate the integrity of the placenta, and even determine the fetal position as the mare gets closer to foaling. It's incredibly valuable for late-stage monitoring and checking fetal well-being.
Its limitation, of course, is that you can't use it for early diagnosis. You need that larger fetal size and fluid volume to get a clear view through the mare's abdominal wall.
Right. Not an early tool. It's truly incredible when you step back to think about this blend of, ancient instinct and really cutting-edge science we're discussing here. And a critical takeaway for all these methods we've talked about is that timing is absolutely key for every single one, both for performing the test and for correctly interpreting the findings.
That's so true. And one of the biggest critical considerations, something our sources really highlight, is the absolute importance of twin pregnancy detection and management. You mentioned this earlier with the 14-day ultrasound. Why are twins such a big deal in horses?
Well, twin pregnancies are incredibly high risk for both the mare and the foals. The mare's uterus just isn't designed to carry two to term successfully. It often results in abortion of both, or the birth of very small, weak, non-viable foals. It's generally a bad outcome.
So that early ultrasound is critical for spotting them.
Absolutely crucial, specifically around days 14, 16, and then rechecking at 25, 30 days. It allows vets to detect twins early, and then, if necessary, perform what's called a selective reduction, usually gently crushing one embryonic vesicle before day 16 or 17. This gives the remaining single embryo a much, much better chance at survival and developing into a single healthy foal. It sounds harsh, but it vastly improves the odds of a successful pregnancy.
Wow, okay. That underlines the importance of early checks.
And related to that, another significant concern is early embryonic death, or ED. It's surprisingly common in mares, actually. Studies show it occurring in maybe up to 10–15% of pregnancies, often in those first 30–40 days.
10 to 15%, that seems high.
It is significant, and this is exactly why regular rechecks, especially that crucial day 25–30 ultrasound to confirm a heartbeat, are absolutely vital. Catching ED early isn't just about knowing the pregnancy failed. It's about understanding why, if possible, and importantly, allowing the mare to be rebred in a timely manner to ensure a successful overall breeding season for the owner.
All right, getting her back on track if needed. And sometimes what you see on that screen isn't what you think it is. A common challenge on ultrasound, apparently, is distinguishing between uterine cysts and true embryonic vesicles. On an early ultrasound, especially to someone less experienced, they can look remarkably similar, creating a real diagnostic puzzle for vets.
That's a very common scenario. So how do skilled ultrasonographers tell the difference? It takes practice. Generally, uterine cysts are typically irregular in shapes. They don't grow over time between scans, and they definitely don't migrate within the uterus. They're fixed structures in the uterine lining. In contrast, as we said, early embryonic vesicles are usually nice and round or oval. They grow progressively with each check you measure them each time, and they migrate within the uterus until they become fixed in one of the uterine horns around day 16.
So you need that experience and maybe multiple scans to be sure.
Absolutely. This differentiation requires a highly skilled and experienced eye, and often comparing findings across multiple scans, say at day 14 and day 25, makes it much clearer.
So what does this all mean for successful breeding? Pulling it all together, ultimately to achieve the most accurate diagnosis and the best ongoing monitoring, it sounds like it's rarely just one method used in isolation.
That's right.
Our sources really emphasize that an integrated approach using a combination of these methods, maybe palpation, definitely ultrasound, perhaps hormone tests at specific times throughout the mare's reproductive season, leads to the most accurate diagnosis and, ultimately, the very best outcomes for both mare and foal. And that pretty much wraps up our deep dive into the fascinating world of equine pregnancy diagnosis. We've explored the subtle signs a mare might show, delved into the skilled hands-on palpation methods, marveled at the visual confirmation from ultrasound, and uncovered the chemical clues from those hormone assays. Each method, with its unique timing and insights, really contributes significantly to managing mare health and ensuring breeding success. It's quite the toolkit.
It truly is remarkable, and how the scientific precision of these diagnostic tools directly impacts the profound implications for equine breeding, for health, and just for the continuation of these magnificent animals. It's really a testament to how human understanding and technology can support and safeguard natural processes, helping to bring healthy new life into the world.
Absolutely. And as you reflect on all this specialized knowledge, consider how it not only helps ensure successful foaling, but also really deepens our appreciation for the intricate biological processes at play, and maybe for the dedicated professionals, the vets, the technicians, the breeders who work tirelessly to safeguard new life. It truly reminds us that even the most ancient practices, like bringing new foals into the world, are constantly being refined and perfected by cutting-edge science. Really makes you think.